year students, fantastic. And second years, did the two, was that a two? Got it, I see, I see, you were putting your fingers up. I thought you're all first years. Anyway, really great to see everyone, and we're excited for our first food for thought of the year. So we're going to do that with Dr. Christian Gloria, which obviously, you know, he's the speaker today. Sorry, maybe we need to mute someone on Zoom. There are some people on Zoom, but I'm not sure if I know who they are, but let's hope. If you're on Zoom, would you please mute yourself? Thank you. Can't see them. So let me just very briefly introduce Christian, and then we'll move to his presentation, and we'll certainly have questions and discussion probably during as well as at the end. So let me just say, I believe that we're celebrating 1 full year of Christian being with us. I think he started on October 1st. So it's almost a 1-year anniversary, and we're very pleased that we were able to get Christian to join us. Many of you may know that he is now the Deputy Director for the Master's Program and the lead of the Health Promotion Certificate. Maybe that's one of the couple of the reasons many of the students are here. And he's also the PI now of our HRSA-funded Region 2 Public Health Training Program. So those are the things that we got him to come for, as well as all of his teaching, which some of you probably have him in class or will. And as we know, as his faculty colleagues, we're very pleased that he's here. Just briefly, he did get his PhD in health behavior and health education from UT Austin. And I met somebody today who went to UT Austin undergrad, Christian. So there you go. Welcome. Welcome to Mailman, Brett. He then spent almost a decade at Hawaii Pacific University. So you may ask, how did we get him to New York from Honolulu? And I would let him answer that question. I don't think I can answer that in any way other than he doing so. But he was very productive there, developed a number of programs. It was remarkable that he had the amount of teaching and related experience that we were so looking for. So just want to say we're very glad he joined us. I had this whole paragraph about what he's done in the Philippines, but he told me to skip it because he's going to tell you himself about sort of his progression there. And I trust that he will probably do certainly a better job than I could in introducing him. So I'm just going to pass that on to him and welcome him. And thanks again, everyone, for coming.
Thank you so much, Kathy, and thank you, everyone. I don't think I've seen so many people show up for Food for Thought. I'm certainly feeling the pressure, and I know a lot of those are probably from pressure from my students who I've invited to join us. I'll try to be mindful that we have some folks on Zoom. Welcome, hello, good afternoon, or good morning still. I know that we can't see the Zoom chat box, so I don't know if anybody in the room is monitoring it, but I do welcome folks towards the end. I'll dedicate some time for Q&A, and so feel free to just turn on your microphones and speak to us from the skies because we cannot see you in our screens right now. So thank you again, Kathy, for inviting me to speak. I didn't realize it's even the first Food for Thought for the year, so more pressure on my shoulders. But really wanted to just have an informal chat, really to sort of show you, introduce to you a little bit about the Philippines, all of the public health opportunities and challenges, give you a bit of a background for where we used to be as a nation, as a country, where we are now and where we hope to be in the future, and the little tiny roles that I play throughout those time points. I mostly will talk about the work that I've been doing and research and service and developing education programs and community programs, and really leave it open-ended. And the open-ended part is really to invite you all to hopefully consider collaborating with me and some of my partners in the Philippines. I'm building a student exchange, faculty exchange program with Mailman and institutions in the Philippines that might be as soon as this December to January, should COVID allow. So really hoping that this will be planting many seeds for you to think about, food to think about and chew on, and really looking to exploring collaborations with you all one way or another. And so aside from the roles that Kathy mentioned, I do serve as a visiting faculty of public health for a couple of the universities in the Philippines now. It's been challenging moving to New York and the 12-hour time zone difference. Interestingly, in the Philippines, most of the public health graduate programs are all day Saturdays. And so for me, it's Friday night. but it's a lot of fun just being able to give back one way or another. I was also a balik scientist. One of my lines there translated as a visiting or returning scientist, the Philippine government's attempt to reverse the brain drain and bring back the talented and skilled Filipinos from overseas, from foreign lands, to go back home, to be able to give back and train our professionals there and our soon-to-be professionals, our students in our workforce. And I also served as a mental health researcher, a consultant for the government, the university there, which I'll talk about later today. A lot of the work that I've done had been postponed through COVID, but I began returning again this August and hopefully be able to restart what we left behind about 2 to 3 years ago. So I wanted to just introduce you a little bit, really informally, about my humble beginnings. That used to be my home in Manila, Philippines, one of the most densely populated cities in the world. It's since been demolished a couple of years ago. So that was my family compound where my many generations of my bloodline had lived. And I was surprised to hear that all of the property had been demolished because my aunties and uncles just needed a way to make money, and it was a place, a neighborhood that no longer is really conducive to bringing families, and so they sold the property. But I'm intent on buying that property back, whether it's going to be a vacant space or not, because it's such a near and dear space where I've spent 11 years of my life. So surrounded by food, and Filipinos love pageantries, and so I used to be an escort as well when I used to be cute. I think that was 4th grade. All right, let's see here. Move a slide. So this is Metro Manila, Philippines, the capital of the country, where I spent the first 11 years of my life. Born in 1981, so 40 years later, here I am today. And one of the most impoverished countries in the world, one of the most corrupt governments in the world. I'm being recorded, I have to be careful. But I've told the government that many times, and we just elected a new president this July. Maybe I'll say more about that later on. And what this looked like 40 years ago, unfortunately, is what it still looks like today, and in many cases even worse. A huge disparity, a huge gap in socioeconomic status. So you'll easily be able to see, the wealthy communities with the high-rise buildings, much like here in New York City, and right next to it are what we would even call, or what the government would call, informal settlers. Basically people in poverty who have no ability to afford a home, and they just build up shacks, normally along the river, so that they'll have some source of water for drinking, for cooking, for washing, for everything. And so pictures like this were images that I remembered growing up in the Philippines 40 years, 30, 40 years ago. And when I started coming back in the recent years to do my work in public health, it continues to look exactly the same. Nothing has changed in the Philippines in the last at least 40, 50 or so years. We don't have a proper water system. We don't have a proper sewage system. To this day, you could go up and down the country. You could go to the wealthiest communities and you still cannot drink the tap water. So we heavily rely on bottled, purified, filtered drinking water that of course is a luxury to those who could afford it. We don't have a proper sewage system. The rivers are still considered the trash dumps. Either you throw it in the river or you burn it in your backyard. We don't have a proper garbage collection system. So one of the most plastic polluted countries in the world also. I believe we're number 3. We're a small country compared to the rest of the world, but we are like the number 3 greatest producer of plastic pollution. A lot of it has to do with the poverty. Everybody buys things on, like for example, if you need soap and shampoo and something to snack on, something to drink, it's always a daily supply. You buy just what you could afford for that day. And people normally, the minimum wage there is 500 pesos, which is about $10 a day. So most of the people are living day to day with what they can afford. So aside from not being able to afford the basic needs, food insecurity is a huge problem. During the pandemic, the government very proudly announced returning what they call the Nutri-Bun, which started about in the 70s and 80s as a way to supplement food for for the communities when we were recovering from wars. And so during the pandemic, the government was really proud to bring in again the Nutri-Bun, a nutritious bun of bread, a roll of bread, back to the school system, and they thought problem solved. I'm like, no, that's not something to be proud of. And food continues to be a very big problem in the country. We used to be one of the biggest importers of rice, and now we've become one of the biggest exporters of, we used to be one of the biggest exporters of rice, and now we've become one of the biggest importers of rice because we no longer produce enough rice to feed our people. We rely heavily in other countries around Southeast Asia. And so when I was 11 years old or 12, my family left the Philippines for better opportunities, moved to North Hollywood, California, and Los Angeles, California. And I'm thinking, what? You could drink tap water? What? You have electricity? What? You have phones and computers? So it was quite the culture shock. And my parents, who used to be bankers, and we were upper middle class, we had a relatively comfortable life, but still quite poor. They left everything behind to find better opportunities for the family and of course for the kids. And they worked. My dad worked as a washed cars in Los Angeles, California. My mom worked at Walmart selling shoes and somehow managed to support the family. Struggled to again support the family in California with the meager income that they were earning. And thankfully, my uncle, who worked for Dell Computers in Austin, Texas, invited us to go to Texas, helped my father and my mother find better jobs. And I spent almost 20 years in Austin, Texas, going to school there and earning all of my degrees, as Dr. Sigma mentioned, my bachelor's, master's, and PhD, all at the University of Texas. Not because I wanted to stay there for 13 years, but because I couldn't even imagine going out of state. I was kind of an international student paying international fees, and it was close to home. And I was just so lucky that UT Austin was such a great institution and offered a lot of opportunities for me, and as well as a lot of grants and scholarships to allow me to afford it as a first generation college educated someone in my family. After earning my PhD at the University of Texas, I moved to Honolulu, Hawaii, mainly because I wanted to go back as close as possible to Asia, go back home. For 25 years, I wasn't able, once my family went to the United States, we hadn't come back for 25 years, and mainly because we sort of overstayed our welcome in the United States. We were barely documented, and we feared that if we had left the US, we wouldn't be allowed to come back. We just finally got case closed on our deportation proceedings, and just closed it last year, actually, and officially became a US citizen this January, 28 years later. So my parents have been wonderful because they so protected the kids, my brother, my sister, and myself. We barely have any idea about any of those legal proceedings. Even to this day, they don't talk about it. But it's such a big weight off of my parents' shoulders once we're done worrying about possibly being deported until last year. And so again, being able to see the world through Los Angeles, through Austin, Texas, through Hawaii, and now New York, I'm thinking about all of the possibilities about what I could do back home, especially with my public health training. And so let's see what's in here in New York City. I'm very, very happy to be here. And how did you get me, Kathy, to move from Honolulu, Hawaii to here? How could I not, right? I think everybody was worried, like, oh, I don't think Christian can cut it in New York City, coming from such a small island in Honolulu, Hawaii, living in paradise. But after 10 years in a small rock in the middle of the Pacific, it's time for change. And I've been very vocal about it. The leadership in my last institution are very, very aware of my opinions. During the pandemic, they were just making decisions as a university leadership that were very, in my opinion, not aligned with public health recommendations, right? And so they placed me as the department chair of public health there at the time in a position where I couldn't support their decisions. And so myself, and thankfully I wasn't alone, it's not just me being personal, half of the public health faculty, half of the nursing faculty, half of the social work faculty, including all of the department chairs of those schools and departments. We all resigned last year looking for opportunities. And I applied to Columbia. I just saw it out of nowhere, and I'm thinking, well, I don't know if I have a chance, but there's no harm in trying. And I'd applied to a lot of jobs, very open to moving anywhere. I almost went back home to the Philippines permanently. I had a great job offer, but Columbia and Mailman and SMS specifically, after doing interviews with Kathy and all of the SMS faculty, immediately I just fell in love and continued to fall in love. And bought a home for the first time. I moved in here in Washington Heights, bought an apartment just September 1st was my first day. So renovating right now. Tried to get a sofa delivered yesterday, and the delivery guy said, we can't fit the sofa through your hallway, through your door. So you'll just have to get a refund. It's like, okay, welcome to New York City. My hallways are I have to find a way how to get a sofa through my hallway. So in 2017 was when I started taking risks about being permanently deported. I've had a huge heartstring in the Philippines. I always keep them in mind. I keep my family and friends in mind. Been away for 25 years and thought I kind of got bored working and helping Americans. You guys are doing quite okay. And I thought I want to go back home and do good work. And I hired 2 lawyers. And the first one, I said, hey, can I go leave the US and be able to come back? And she goes, I wouldn't risk it. So I said, I don't like that answer. Let me go to a second lawyer. And the second lawyer said, I checked the immigration office and their database, and it looks like you basically don't exist. She goes, the good news is you could probably leave the country and you'll be able to come back. They're not going to see anything. They're not going to see any flags, but we don't know what the consequences are of the fact that your file doesn't exist. I'm not on the record. Now I am. And so I took the risk in 2017. I was still in Hawaii Pacific University. I said, I want to go back home. I have in Hawaii, if any of you are familiar, we have a huge Filipino community that initially moved to Hawaii State in the 50s and 60s, be farmers, because Filipinos are good farmers. And the population exploded since. And now Filipinos are the second largest ethnic group in the state of Hawaii, first being white Americans. And so I always tell the Filipino communities in Hawaii, like if we were just more civically engaged, we could practically own the state of Hawaii. But people don't civically engage and don't vote. So we'll get there at some point. It used to be the Japanese Americans who were the second largest or the largest Asian subgroup, but we've outnumbered them since just about a decade ago. So I decided I went back and forth in the Philippines, and the immigration office didn't put me in jail or deport me permanently. So I just kept taking risks and I kept going back and forth. And I had plan B. So like if I get stuck in the Philippines, I know I have other backups. And so luckily I was able to go back and forth. And I've been up and down the country since 2017. And my main mission really was, because I realized there were so many Filipino American students in Hawaii and going into our university, into our public health programs, many of them, the majority of them, were born and raised in the US, have no idea anything about the Filipino culture, the Filipino identity, have no interest in going back home. So it became personal for me. I said, I'm going to go back to the Philippines. And most of these cities that I visited are practically all of the higher education institutions that offered some kind of a public health program, whether it's a bachelor's, master's, or doctoral. And thankfully, we have those kinds of programs, and the programs that they offer are primarily copied and pasted from American programs. But none of the schools or programs of public health in the Philippines to this date are accredited. And one of my little jobs there is to help the universities design programs that are going to be ready for CEF accreditation for the Council on Education for Public Health that's based here in the US. So my plan was just to build bridges between universities there and universities in Hawaii or in the US to develop short-term, long-term study abroad, internships, exchange programs for faculty and students so that we can have some kind of a bridge and a pipeline. And my selfish want to bring more students to the Philippines so there'll be more of a spotlight regarding all of the public health needs and all of the help that we need from the outside world, because locally in the Philippines, we just don't have the workforce. One of the works that I'm doing now there is is a very ambitious initiative to sort of redefine the public health and medical model. Public health, not too different here in the US, where we don't quite know how to define public health because it's so broad. In the Philippines, simply put, public health is defined as sending the medical doctors and nurses out in communities outside of the clinical setting. Very, very reactionary, very about responding to symptoms and problems, but never talking about, or really not even aware of social determinants of health, of root causes, of upstream approach. And so my job is to humbly talk to the higher education institutions, to governments, to the healthcare system, to begin those kinds of conversations, which have started in the last couple of years about, what does public health look like? We have BSPH, we have MPH, we have the RPH programs in the country for decades, but there's no job. You get a public health degree, there's no job. If you want a job in the DOH at the Department of Health or the CDC or World Health Organization or other local health organizations, they want a nurse or an MD. So what does it mean to have a public health degree? It means nothing at this point. And so we're trying to change that. So visited many universities across the country, and thankfully they were very open-armed about looking at ways to partner and collaborate, whether to design education programs, professional public health programs, changing the healthcare models and the systems, as well as establishing those research collaborations. So if any of you are interested in research, I have an endless list of institutions, governments, and organizations who are looking just that. I'm very excited to also share with you that ICAP, which I know everybody knows and loves, finally established an ICAP center in Manila, where I'm from. And I know they've been looking for a country director for 2 years, and I helped a little bit spread the word. And I'd like to take a little bit of credit. I think maybe I'm one of the reasons they found somebody. I can't quantify that with evidence, but they finally hired somebody to start just a few months ago. And I've been away since the pandemic. I wasn't allowed to come back, but I finally returned just this August, and I had an opportunity to reconnect with my partners there and collaborators, and also had an opportunity to meet with the new ICAP director in the Philippines, which is so very exciting for me. Another thing that's very exciting in terms of the developments in the country is that finally, the country, the nation, and the government recognizes mental health as an actual real issue. And this was just passed in 2018. And so in the history of the country, there was no recognition of mental health. Most people believe that mental health is just a curse from the demons, or something that you have as a punishment from being a bad person in a previous life. If people have mental health disorders or illnesses, it's very common even to this day to basically keep that as a family secret. It's quite common to see people who have mental illnesses, mental health disorders, to be literally chained and caged in a family's basement or an attic. Because first of all, they don't understand it. Second of all, if you wanted care, there's no care available. But thankfully, we're changing that now. So as of 2018, the president, who I didn't love very much, but he does a couple of good things, finally signed off the mental health law that now not only recognizes it as an issue, but also creates space and funding and support and resources for research, for developing programs, and offering for programs in all kinds of settings, in healthcare, in schools and communities, etc. And so that's what then started my job as a balik scientist, a returning scientist. When I started running around the country, visiting institutions, they invited me to collaborate. A faculty from Angeles University Foundation near my hometown was ambitious enough. A department of psychologists wanted to tackle this research endeavor, which they've never tried before, was to do a community population-wide mental health surveillance using the DSM-5 instruments. And so they invited me to be a research consultant, because most of them are clinical psychologists. They've never been out there in the field collecting data for communities population-wide. So that was my humble role, to sort of help them with their research methods. And from 2018, 2019, 2020, until the pandemic stopped our tracks, we were just going around communities and starting in a small province, community to community, conducting mental health surveillance across the lifespan, from school children to adolescents to adults and all the way to elderly groups. And I hesitate to share any of our pilot data because, oh my gosh, I question the validity of a lot of our findings, especially once I got my experience going through the data collection and observing the research methods. Just language alone was such a barrier. A country divided by 7,400 islands, I think that was 7,462 islands or something like that. We speak almost 200 distinct languages, and many of the languages are never taught in school. Many of the languages are dying. And so just even in one little province, the children and the adolescents preferred Taglish, which is like a mix of Tagalog or Filipino language and English, because they watch a lot of Western media. The adults preferred Filipino, which is the national language of the Philippines, but not everybody knows how to speak it well. And then the elderly spoke a different language, Kapampangan, which is very local to that community, but a language that's no longer being taught in the schools. And so language was an issue. It's like, oh my gosh, I don't know if they completely understand the questions. Even when we were sort of one-on-one interviewing them, interpreting the English DSM-5 instruments, for example. And we struggled to measure, what we would deem as simple measures like depression. Like what is depression in our language? We don't have a word for that. And interestingly, when I asked one of the community members, or my colleagues, what is the closest that we have to translating the word depression? And they said depresión. A little about Philippine history is there's a huge Spanish influence. A lot of colonists came through our history, and interestingly, we celebrate colonialism in most parts of the country, another topic of conversation. So that's their closest word, depression, but we didn't know how really that translated and how that culturally adapted. The closest we got to a translation that really feel like it hit home in terms of more accurately measuring that variable is the English term for it is feeling a heavy heart. We're like, I don't think that's depression. So we had really, really interesting findings. The overall, the results in terms of stress, anxiety, PTSD, depressions, all kinds of mental health symptoms were a lot worse than what we expected. And we expected pretty bad. But we will need to revisit our methods to make sure that our data is valid, our results are valid. One of the most interesting unexpected finding was a very, very high rate of eating disorders among the elderly community, elderly female community. And we're thinking, that's so unexpected. I wonder what's going on. And so our best educated guess was in our culture, it's very, very typical every lunch or dinner time to ban and remind grandma and grandpa that you can't eat that, you can't eat that, you can't eat that, because most of our grandparents suffer from multiple chronic health problems. And to us, diet is the one major contributor to it. And so we say, you can't eat that, you can't eat that, you can't eat that. And so we think they've sort of internalized this sense of like, I can't eat anything, which might have been what's reflected by this eating disorder, that they're not allowed to eat anything. And so we had some good data, and at least we have some data to work with to sort of shed some light on what's going on in terms of health status in the Philippines. And our next goal would have been to begin developing programs based on the data, based on the evidence. But then that's also when the pandemic hit. And everything stopped completely. Everything stopped. The Philippines had been one of the hardest hit countries by COVID. Across Southeast Asia, across the world. We were also one of the worst in terms of response. And so we as a nation have been devastated by COVID, and just now barely able to return. The country, the Commission on Health Education mandated all of the schools to be fully in person starting now. They just started the school year about a month ago, and they had been completely 100% virtual since the beginning of COVID until this month. So they've been struggling with that transition. And so it's been hard to restart what we had left behind when COVID began in terms of this work. A couple of my, like for example, I work really closely with 10 people, 10 researchers, 10 faculty in this work and others. Two of them had passed away. A couple of them had been diagnosed recently with advanced, some form of cancer. Many of them have become very, very sick, and now suddenly feeling all of the stresses and pressures of being able to go back to classes in person. And a standard full-time faculty load to teach there is about 8 classes per semester that you have to teach. So it's a lot. And when you ask faculty in the Philippines to do research, they don't get course releases. We don't have that kind of model in the Philippines. If you want to do research, add on to teaching 8 classes a semester. And then the compensation is tiny. And so those are some of the squeaky things that I also say out loud all the time when I'm in the Philippines, where we want to do more research. The government wants us to do more research and be able to produce our own data. But we need to be able to enable that, support that by changing how we model being a teacher and a scholar. And so since 2017, I've been up and down the country, connecting with all kinds of institutions, doing talks, providing all kinds of trainings in needs assessment and program planning and evaluation and research methods. So it's been a wild ride going up and down the country, providing these kinds of the knowledge and the skills that I've stolen from the US and brought back home to share the wealth and some of my fortunes over my last 3 decades here in the United States. One of the biggest problems or challenges for me when I go to the Philippines is when you show up in the Philippines, immediately it's in your face, the countless public health problems. And the challenge is, where do you begin, right? When I first started visiting again in 2017, one of the first things that I wanted to work on was what they would term the street children. And there are, in my city alone in Manila, there are estimated to be about 20,000 children. And these are children that are pre-teens and early adolescents who are out on the streets like Lord of the Flies with no adult supervision, victims of all kinds of abuse and trafficking, etc. And it's become very normalized. And these street children are even seen as sort of like rodents and roaches that people don't want to think about, don't know how to address, because the country has been on such a fight or flight mode for decades, just trying to survive, let alone be sensitive to the world around them. Question.
Has that issue become more prevalent since the pandemic with like parents dying?
Absolutely. And there's many roots to the street youth problem. As a country, for example, abortion is illegal. Contraception just became legal in the last couple of years, but even if it's legal, you're not going to find contraceptive pills anywhere. And even if it's available, the pharmacists actually might refuse to offer it because of their more conservative beliefs. So there's also a sense of having more children is life insurance. Having more children means that you'll have more people who can bring income. A lot of the street children were left behind by parents who either went missing, died, or had been separated because of all of the natural disasters that happen all the time in the country. We just got hit by another typhoon, 18-meter floods that they're dealing with right now. In the Philippines, again, in my home city in Manila, one of the densest, most densely populated cities in the world, if you are in the street markets and you, as a child, this almost happened to me, grab onto mommy, right? And suddenly maybe you got separated because I'm looking at something and mom is shopping at somewhere else. There's a lot of chances that you'll never find your parents again. It's that simple. One of the reasons why my family decided to move to the US actually was because there was an attempted kidnapping for me. I don't think I've ever shared that before. It was just not a very safe place. And so thankfully my parents were lucky enough to be able to afford leaving the country. So yeah, a huge street children problem, and no ways to address it. So help me out with that one. And so I know I wanted to be short on my presentation today, but basically this is one of my last slides to just show you some of the things that I have been working on, either as a consultant, as a co-researcher, as a private investigator or a principal investigator for the universities there and or the government. I talked a little bit about the mental health monitoring system. Telehealth and teleeducation have been something that I've been very squeaky about even before the pandemic, being mindful that, we have a country of 7,600 islands, and access is a huge limiting force. Just the geographic access. Most of the access to the best schools and the best healthcare systems are in my home city, in the capital city, Manila. So if you live in any of the other neighboring islands, many of the islands haven't seen a doctor or a teacher in person in over 10 years. And so before the pandemic, I was being really squeaky about we need to develop and figure out how to do telehealth, teleeducation, everything, because that's the only way we can provide access. The beautiful thing about the Philippines is we have a really good infrastructure in terms of satellite services, of cell phone services, of mobile device services. The Philippines, interestingly enough, is one of the highest users of internet, but perhaps because we are a country of 7,000 islands, that's how we connect with each other. So thankfully, through the pandemic, we were forced to figure out how to tele everything, and it's been very successful in providing not only access to health, but also access to education. And so one of the things that I'm working on with the education institutions there right now is to not only develop their bachelor's, master's, and doctoral programs in public health, but also converting them into online programs. Very lucky that when I was in Hawaii the last 10 years, we developed a fully online master public health program and a Bachelor of Science in Public Health that we purposefully developed to be fully online so that we can serve our neighbor islands in Hawaii state, which is just comprised of 8 major islands. And so working with several universities in the Philippines right now to develop just this. Interestingly, when I was in the Philippines this August and visited with some of my colleagues who were developing telehealth services, they really challenged themselves into first and foremost serving the most marginalized communities that hadn't seen any access to healthcare in over 10 years. And they said to themselves, if we can reach the hardest to reach people in the country and we can show ourselves to be very successful, and they have been, the pilot results just came out, then everything else will be easy. And so that's where we are right now. They received some really successful pilot results and delivering primarily mental health telehealth services. So we're going to then scale that and expand that across the country. Part of my main job or my main personal mission is again helping the school system and the government system and the healthcare system redefine what public health is, put that on a map. They're just very medical model, doctors and nurses, and that's it, clinical and out in the communities. Very, very reactionary, very about responding to problems, but have no sense of the upstream approach, have no sense or sensitivities to social determinants of health, to root causes. And so that's where I become a bit of a squeaky wheel. Like, let's talk about, a different kind of approach. And thankfully, most of the universities there are very, very open-minded. And in terms of the leadership and government, I'm getting there. Interestingly, the Department of Health is one of our biggest challenges because the Department of Health there as a nation is one of the most corrupt as well. And so all of the public health work I do is actually not through the DOH, but rather through the Department of Science and Technology, which have been much more ethical in their ways. And it's been great working with them. And I mentioned to you how we just elected a new president and installed just this July. And he is the son of the dictator, very much sort of like the Trump versus Clinton election results. We were completely taken by surprise. Like, how did this happen? We thought that we were going to elect the one who we wanted, but somehow we're stuck with him for the next 6 years. And to this day, he hasn't yet appointed a secretary of the Ministry of Health. We're thinking that's got to be the first thing that you do upon coming into office. Appoint somebody to the Secretary of Health to be the Director of Health, but to this day we don't have one yet. And I think it's because mostly nobody wanted the job, which I understand why. Because of my work in mental health in the Philippines and because of my training as a PhD student in mental health, a lot of the spotlights and invitations to talk have been around mental health. And I begin my presentations and lectures and talks all over the Philippines. When it's themed for mental health, I always show them the Maslow's hierarchy. I'm thinking, happy to talk about mental health and all that good stuff. But before we can get there, let's be reminded that to this day in 2022, we still don't have our basic needs met. And it's become so normalized that you just don't drink the tap water. It's become normalized that, that you just burn your garbage and you dump it into the ocean, into the rivers. It's very normalized to just be poor. So I'm reminding everybody, let's talk about the basic stuff. Hopefully by the time I die, we at least get a proper water system installed. And I worked specifically recently with the Rotary Club, the Rotary International, to go to pockets of communities and install water purifying systems and water systems so that they'll at least have access to that. Human rights is a big issue. Sexual reproductive health issues are severely stigmatized. Interestingly, when I was there, I was invited by a couple of faculty to potentially apply for a grant with the Commission on Human Rights, I believe was what it's called. And I said, sure, I'm all about human rights. And then when they sat me down to talk about their ideas, it was centered around the rights of the unborn child. And I'm thinking, oh, we're gonna have this talk now. And I was transparent, that's all I know how to do. And I never got invited to that committee meeting again. So lots of opportunities in sexual and reproductive health. Divorce is still to this day illegal. So there are many cases, especially recently during the pandemic, of domestic abuse, and there's no way out. Divorce is illegal. When you are married under God and it's a marriage that cannot be broken, that's just not an option. It's something that we push into policy each and every year, and to this day hasn't been successful at all. So a lot of opportunities in those areas. Thanks to my new hat, one of my jobs here as the director of the Public Health Training Center for Region 2, specifically serving New Jersey, New York, Puerto Rico, and USVI. I'm also taking in a lot of what we have developed and built from the Public Health Training Center. So thank you to Dr. Marita Mailman, who had built it over the last 20, 30 years. And I'm bringing that with me when I go home about, again, redefining what public health is. That of course, it's not just about providing education and training for the future generations of the public health workforce, but also training the ones who are currently in the DOH, who are currently in community health settings, so that we can be really good at our jobs and promoting public health and focusing on prevention rather than just responding to problems and illnesses. A lot of international collaborations. I've begun a lot of that, developing international collaboration, short-term, long-term, for faculty and students in Hawaii. And I hope to continue that here in Colombia. Of course, Colombia being such a brand, everybody's interested in partnering with Colombia. So Kathy, just a forewarning, I have many MOU drafts already being given to me. I have a collection of them, and I'm happy to figure out how to move that and develop that into our next steps. Really, I've over the 5 or so years, I've been thankfully very successful developing great relationships with the universities, with governments, even with my enemies. I am really good with making friends with enemies and finding common ground. And so a lot of opportunities that I alone cannot do, and I'm really good at finding people and partners and collaborators. And so all of the great work that all of you do, faculty and students and researchers and staff, that I've been doing here in the US and other parts of the world, are certainly the things that we need in the Philippines as well. So please take that as an open invitation to chat with me sometime and figure that out. And part of my secret mission also is to reverse the brain drain. That's part of the purpose of the Balik Scientist program. I basically get paid $200 a day to just be in the Philippines, funded by the Department of Science and Technology, to do all kinds of anything. It's not only for public health, it's anything. Technology, for science and math and engineering, etc., for all kinds of research and developments. The only downside is you have to be of Filipino blood, who is a foreigner, and you get $200 a day just to show up and be able to do some good work, which always has been very troubling for me at the same time, because here I am there I am in the Philippines getting paid $200 a day, and I am surrounded by colleagues who are getting paid $10 a day to do their share of the work, which is equal to what I do, right? So I'm always looking into figuring out how to bridge opportunities for students and faculty to come along with me. And for the most part, it's been a very successful bunch of programs that we've developed in Hawaii that I hope we could do here in Colombia as well. So a lot of opportunities in public health. If you can think of any particular public health problem, we have it there times 100. So we need all the help that we can get. And in terms of funding, I have a great relationship with the Department of Science and Technology. And I have, I don't want to say a key, but I certainly have somewhat of a key to a lot of funding opportunities. And you don't have to be a Filipino blood, as long as you'd like to collaborate with me for both faculty and students. There's a lot of monies to be had from locally from the Philippines, from international partners, and even from the private sector. Okay. I know I got 10 minutes left, and so I basically find myself in all kinds of spaces in the Philippines, and I always have to remind myself when I realize I'm not sleeping anymore. It's like, oh, this is what I do for my passion projects and my nights and weekends, but I love it. And so having said that, I really do need all of the help that I can find. So please take that as an invitation to collaborate with me. That's it, to a little bit of a little history context about who I am and what I'm offering on the table. Any questions? Thank you all.
I have one.
Sure, go ahead, please.
First of all, I just want to thank you, Christian. This is just so eye-opening and terrifying. You, as usual, gave such a precise and clear presentation. Thank you so much. But I have a question that's very general, and you may have answered it already, so because I had to come in late. But I'm wondering whether you could talk a little bit about the history of the Philippines, the history of colonialism, why the public health department is such a object of, in some sense, corruption in that context. What is it about, your country's experience with Spanish American colonial experience that plays into the kind of terrible poverty and disorder that we have? Just some general overview so that we could begin to understand the dimensions of what you've discussed, which are so terrifying.
Thank you, David, for that question and the kind words. Oh my gosh, such a question to answer. This is not a direct answer to that, but rather the reality. The Philippines as a country is terrible at maintaining its history. Even the currently elected president and his family, his dynasty, have been really, really good at deleting and revising history. And so when I go to the Philippines, for example, when I go there in January, they have a huge weekend-long festival, basically celebrating colonialism and celebrating the Spanish bringing Catholicism and Christianity, for better or for worse. And it's an interesting space where not only are we good at erasing our history, celebrating colonialism, but even romanticizing and looking into the Western world as our standard of beauty, our standard of who we want to be. And so that's my one response in terms of the impact of colonialism. Interestingly, one of my main collaborators in terms of universities there, Silliman University, one of the oldest universities in the country, was actually built by Americans. And a lot of our programs are always look into the American system in terms of developing, their education programs. They recently, the country, completely reorganized the calendar system of the education systems. Normally we're done at grade 10 and then you go to college. Now they added grade 11 and 12, just like the American system. And so that we are aligned with the calendar academic system. But because thankfully education is very much number one as a culture in the Philippines. That introduced so many problems, introducing grades 11 and 12 into the college system. But we always look forward, we look to the American and the Western world as our golden standard and our model. In terms of the corruption with the Department of Health, corruption is widespread across the whole government system. It gets worse the closer you get to the local level. Well, bribery is the language for access. So you go down to the villages, you go down to the communities, and it's very, very common for the community leaders to say, oh, you want access to our community? You know, where's the money? Where's the money? So corruption is a big problem. The governments and the elected officials that we have are family dynasties who go into office for the main purpose of becoming wealthier. And that's exactly who we've elected into office today. And if you ask people now, especially after we've re-elected this family into office, that in the 80s, we kicked them out of the country, never to come back, not allowed to come back. But succeeding officials allowed them back entry into the country. And they've somehow regained the popular vote. There was a 30 million gap vote in terms of the election results. And when we as a nation were looking back, trying to understand what happened, it's because the people as a whole have forgotten the abuses that we had endured during the years when that family was in power. So could certainly use your help, David, Dr. Rosner and Merlin, in terms of reminding us of our history and its role and implications on public health. Thank you. Yes.
Okay, I have a question. Kind of building off of this question, and just the idea of the government and corruption. I think something in the US that a lot of public health researchers think about is NIH and NIH funding and what that looks like. And I think from what I just did a search on NIH Reporter, in terms of Filipino research, it seems that there's not much. There's one collaboration on capacity building between Brown and UT Manila, and there's a few like RTP ones there as well. And I was curious, just given your connections with local leaders and your collaborations there with the communities and the government, if you feel like there's maybe a distaste from the Philippines of US kind of either collaborations or assistance, and whether you think NIH funding or US public health researchers going through that route, how that could like potentially be a way to materially support Filipino health.
And yeah, great question. And that's exactly what's happening now, where we are seeing more and more collaborative opportunities with the international agencies like the NIH. I'm thinking NIH with the US, right? But as well as NIH in the Philippines. A lot of the work that we have in the Philippines, a lot of the public health work that we have in the Philippines are normally internationally funded because we don't have that model locally in the Philippines. Like ICAP is supported, I believe, either through NIH and or CDC. And so they're helping us fund that to be able to provide chronic healthcare services for chronic diseases, not only with HIV and AIDS, but including other things. And I think tuberculosis, for example, is one of their prime targets right now for ICAP. Yeah, great, thank you. Yes.
All the films of Fort Myers Beach were Jim's.
No.
Sorry. Oh. I'll repeat it for you. So the question was, what are the data collection methods in the Philippines? Is it on paper? Is it on some kind of software or online? We do what we can. In most of the communities where there's no internet, there's no computer devices, it's not something that they can afford. So we go there with paper and pen. And when we are going into those communities, who may not speak English at all. We bring in a team of interpreters, of language translators to try to bridge those kinds of barriers. There is one of my colleagues in the University of San Agustin who's Filipino American. He went to school in California, just established in the last year the Center for Informatics. And he and his team have been the ones who are working on telehealth, developing telehealth and teleeducation services. And his Center of Informatics is becoming now the National Center for Electronic Data. And so he is, finding funding from all kinds of sources to be able to equip communities and healthcare centers with tablets, with devices, so that they can begin digitizing data and sending it right back into the center so that we can have a central repository for data and information. But in most cases, it's through paper and pen. Yes, Kathy. Oh, one more question, sure.
Thank you so much for the lecture. It was really, really
Thank you.
super. It really seems like you're paving the path to get a lot of public population. Something I'm wondering is, what are, if you take safeguards or any ways to help support the work that you're doing, so that way, the time that you're not there, or just in general, like, kind of like, I know like peers, that like it's something that they can look onto or like help build.
Yeah, and so I think your question was, how can we keep records of the good work that we're doing so that we can make sure that it continues on? Absolutely. And so one of the things that the universities there love is publications, right? And presentations. And one of the things that I have had to do was, as a product of my funding from the Department of Science and Technology, was not only to have publications, but also to have developed manuals for how to do these kinds of things. So we're continuing to work on that. That's been one of the hardest things for me to do, actually getting published, because co-authoring with colleagues there, even though they're bright and more than capable, they don't have the time. And during the pandemic, all of our writing stopped. So I'm trying to restart that now. Yeah, thank you. Thank you, everybody, for the questions. If you have any more questions and want to discuss, just please send me an email. My email address is down at the bottom, or christian.gloria@columbia.edu. Thank you.
So I'm just going to quote the student that said that was cool overall. So I just want to thank you, Christian. So thanks for coming, everyone. I just want to say it was fantastic, Christian. Thank you. It allowed us to get to know Dr. Gloria better. And next month, October 19th, we also want to continue the sort of conversational nature of some of our topics. So Dr. Merlin Chauquanian and Dr. Diana Hernandez are going to have what we're going to call chat and chew, just a little more conversational to talk about opportunities for research in climate and from a social science perspective. So that's our topic next month. So thanks, everyone. Great to see you. I tried to get on my phone.
We have
But it wouldn't.
7 people so far. So Yasmin, Elaine, Barney. Somewhere have come up. Yeah.
Yeah, let me just get on. I won't be
Are you teaching soon, Bob? Thank you. All right.
Someone is thinking about 2:30, but let me know.